Today I am discussing the topic of the stomach on the model. This is a model of the stomach. The stomach is the most dilated part of the GIT and has a J-like shape. Positioned between the abdominal esophagus and the small intestine, the stomach is in the epigastric, umbilical and the left hypochondrial region. The stomach is divided into the 4 regions. The first region is the cardia. This is called a cardia region, which surrounds the opening of the esophagus into the stomach. This is the cardia region. The second region is the fundus of the stomach. This is called the fundus of the stomach. This is the fundus of the stomach, which is the area above the level of the cardia orifice. And this is the cardiac notch, cardial notch. The body of the stomach. This is called the body of the stomach, which is the largest region of the stomach. And the last part is the pyloric part. This is called the pyloric part, which is divided into the pyloric antrum. This is called the pyloric antrum part. And the pyloric canal. This is the pyloric canal part. And is the distal end of the stomach. And this is at the distal end of the stomach. So this is the cardia. This is the fundus. This is the body of the stomach. And then the pyloric region. First of all, the pyloric antrum. And then the pyloric canal is present. The outlet of the stomach, which is the pyloric orifice, is marked on the surface of the organ by the pyloric constrictions and surrounded by the thickening ring of the gastric circular muscles, the pyloric sphincters. The pyloric orifice is just to the right of the middle line in our middle plane, curvatures of the stomach. The stomach have a greater curvature, which is a point of the attachment of the gastrosplenic ligament and the greater omentum, and the lesser curvature. This is the lesser curvature, which is the point of the attachment of the lesser omentum, and the angular insula. So this is the angular insula point, which is a bend on the lesser curvature. In the lesser curvature, the 2 arteries run. First artery is the direct branch of the celiac artery, which is called the left gastric artery. And the second is the right gastric artery branch, which is a branch of the hepatic artery. In a greater curvature, 2 arteries run. The first is the right gastroepiploic artery, which is a branch of the gastroduodenal artery. And the second is the left gastroepiploic artery, which is a branch of the splenic artery. And the short gastric arteries supplies the fundus of the stomach. Longitudinal muscles, circular muscles, and these are called the oblique muscles or the fibers. Longitudinal fibers, circular fibers, and the oblique fibers. Now we are talking about the nerve supply of the stomach. The nerve supply includes the sympathetic fibers derived from the celiac plexus and the parasympathetic fibers from the right and the left vagus nerve. Here the anterior vagal trunk is shown. This anterior vagal trunk, which is formed in the thorax mainly from the left vagus nerve, enters the abdomen on the anterior surface of the esophagus trunk and then divides into the branches that supply the anterior surface of the stomach. A large hepatic branch passes up to the liver, and from this pyloric branch passes down to the pylorus. So here this is the anterior vagal trunk, and there no show about the hepatic branch, but here is a pyloric branches. Now the posterior vagal trunk, which is also formed in the thorax mainly from the right vagus nerve, and it supplies the posterior surface of the esophagus, and it also divides into the branches that supply mainly to the posterior surface of the stomach. A large branch passes to the celiac and the superior mesenteric plexus and is distributed to the intestine as the splenic flexure and into the pancreas.